Hello everyone. In today's video, we'll be studying about the cubital fossa, which is an important university question and it's asked many a times. So in this video, I'll be covering all the points of cubital fossa in a nutshell. That includes the definition, boundaries, roof flow contents, a clinical aspect and two diagrams. So this is the answer which you'll be expected to write for the exams. So let's first define it. It is a triangular hollow situated in front of the elbow. It is homologous to the popliteal fossa situated at the back of the knee. It is a triangular hollow, meaning in the shape of a triangle, situated in front of the elbow. This is an important thing to write, in front of the elbow. It is homologous, meaning it is similar to that of the popliteal fossa, which is situated at the back of the knee. This is a cubital fossa which is drawn in front of my elbow. So it is a triangular hollow that is situated in front of my elbow. Boundaries include, it's a triangle, so it has a medial, lateral, a base and an apex. This is the lateral side, medial side, the apex and the base. Laterally, it is bounded by the medial border of the brachioradialis. Medially, by the lateral border of the pronator teres. Base, it is directed upwards and it is represented by an imaginary line joining the front of the two epicondyles of the humerus. And the apex is directed downwards, pointed where both the medial and this is the two borders and this is the base, this is the apex. This is the lateral side and this is the medial side. So laterally it is bounded by the medial border of the brachioradialis. This is the lateral medial. So medial border of the brachioradialis. Medially, it is bounded by the lateral border of the pronator teres. So it is, this border is lateral, this one is medial. So it is bounded by the lateral border of the pronator teres. The base is directed upwards. It's directed upwards and it is represented by an imaginary line joining the two epicondyles of the humerus. The base is an imaginary line that is represented by joining both the epicondyles of the humerus. And the apex is a point. It is a point where both the medial and the lateral borders meet. So this has skin, superficial fascia, deep fascia and bicipital aponeurosis. The skin is the outermost, beneath that is the superficial fascia, beneath that is the deep fascia, and then we have the bicipital aponeurosis. So 1, 2, 3 and 4. The superficial fascia contains the medial cubital vein that joins cephalic and in the body. This is the basalic vein and this is the cephalic vein. Okay, the cephalic vein lies laterally to the forearm and the basalic vein lies medially to the forearm. In between both is the medial cubital vein which connects both these veins. So this is the medial cubital vein. Okay, so the superficial fascia contains the medial cubital vein that joins the cephalic and the basalic vein. The cephalic vein lies along the lateral cutaneous nerve of the forearm and basalic vein lies along the medial cutaneous nerve of the forearm. So this is lateral, median, this is the medial cubital vein, this is cephalic and basalic vein. Now the contents. Let's remember the contents with this mnemonic MBBR. We know MBBS, so you can remember it as MBBR. M MBBR. That is, M stands for median nerve, B stands for brachial artery, B stands for biceps brachii, and R stands for radial nerve. So the contents of the cubital fossa is medial nerve, biceps brachii, brachial artery, and the radial nerve. The contents of the cubital fossa. Now the contents. The contents is MBBR. That is the medial nerve, then is the brachial artery, then is biceps brachii, and the radial nerve. There are 4 contents in the cubital fossa: medial nerve, brachial artery, biceps brachii, and radial nerve. Medial cubital vein, it is the vein for intravenous injections. Wherever, I think most of you all have gone to the doctor for maybe blood donation or to extract or remove your blood, the medial cubital vein of the cubital fossa is the one that is mostly used for intravenous injections. The BP, that is the blood pressure, is universally recorded by auscultating the brachial artery. We know that most of the time we take the BP cuff is put around your arm. So it is done by auscultating the brachial artery. And the anatomy of the cubital fossa is useful while dealing with fracture around the elbow. Okay, so these 3 points are required to write to your answer. Whenever you're writing any answer for anatomy, make sure you add an answer for clinical anatomy. So that's it. Thank you guys, and hope you guys liked the video.